All right, Mrs. K here. We're here to talk about choking and chapter 4. We're going to expand on our third C, so care. How can we care for someone who's choking? So in this chapter, you're going to understand some risk factors associated with choking, be able to recognize signs and symptoms that someone is choking, as well as understand how to care for choking emergencies and how they differ between adults, children, and infants. So choking occurs when the airway becomes either partially or fully blocked by some type of foreign object. The foreign object can be food, a small toy. It also can happen when the throat swells, or there's fluid such as blood or vomit that is stuck in the throat, causing someone to choke. We refer to these also at times of being anatomical and foreign object blockages. So anatomical would be anytime anything within your body is causing the choking, so the swollen throat or potentially the vomit or the blood, versus foreign objects would be food or a small toy, anything that's introduced into the mouth by swallowing. Choking is particularly common in small children. However, it can happen to anyone, and it does happen to people of all ages. Now, why does it happen to smaller children more than larger adults? So you should be thinking that, well, smaller children have smaller airways. Okay, so the smaller the airway, if they try to introduce something by swallowing a piece of food that is too big for them, it's not going to be able to be digested as easily as it would be in an adult. A person who is choking can quickly become unresponsive and even die if they have a complete obstruction that they aren't able to get any air in. So what are some risk factors we need to talk about when it comes to choking? There are a variety of things that can put someone at risk for choking. Behaviors, medical conditions, food, objects. So when we talk about behaviors, we talk about things such as talking or laughing while you're eating. How many times have you been in the cafeteria and someone tells a joke and you're trying to swallow something at the same time, and you immediately feel like you're about to choke on that food that you're trying to eat, or talking while you're trying to swallow never works either. Also, as adults, we have the tendency of eating very quickly, or eating on the run, or walking while we're eating. So it's really important to understand that all of those are risk factors for causing you to choke. Medical conditions, so some neurological and muscular conditions could cause the person to have difficulty chewing and swallowing, as well as poorly fitting dentures can affect someone's ability to chew food properly, as well as feel the food in their mouth, so being aware of the size of the food once they've chewed it. They might swallow it before they're ready to. And then lastly, most commonly people think of choking on food and objects. Children, when they're young, they like to explore things. They put everything in their mouth. Unfortunately, they are often unable to chew and swallow those things. And when they're too big, they're unable to digest them. If you refer to box 4-1 in your book, you'll see a whole list of choking hazards. So take a minute or two and think of some common foods and objects that people choke on. So things such as objects that are round, so hot dogs, and chop a hot dog into pieces for a child that are perfectly circular, they could flip and get stuck in the child's throat. Also, big pieces of fruit or whole grapes, popcorn, household toys such as, or objects such as coins or buttons, marbles, rocks. These can all be choking hazards. So how do we define or determine that someone is choking? So we're going to list a variety of signs and symptoms that could be an indicator that the person is choking. So a panicked or confused, surprised look on their face. If you've ever been choking before, you might know and understand how scary it is to be choking. Think about being, if you haven't choked before, think about being conscious and being aware, fully aware that something is stuck in your throat and you know that that object needs to come out. They may be holding one or both hands over their throat. Grasping both hands across the throat is the universal sign for choking and should be an indicator to anyone that that person is choking. They may be coughing. Sometimes they are coughing very lightly. Sometimes they're coughing very forcefully. The object doesn't have to be a complete obstruction. So when you have a complete obstruction, the airway is completely blocked off. However, a partial obstruction, an object could be just partially closing off that airway. The person will still be able to cough, breathe, and make some type of sound. If they have a complete obstruction, however, they aren't going to be able to cough, they won't be able to speak, and they won't be making any sounds. If someone has a nearly complete obstructed airway, you might hear this high-pitched sound coming out of their mouth as the air attempts to squeeze past what it has to get by that object. If the person's airway is completely blocked, like I said, they won't be able to make any sound. And then lastly, the skin may at first look very flushed and red, but as the person is becoming deprived of oxygen, they're going to slowly turn blue or ashen in color. So what do we do if someone is choking? Now we are referring to, at this point in time, dealing with someone who's conscious. So if you have a person who is conscious and choking, be sure that you do obtain consent. So at any time you have someone who is conscious, make sure that it is okay that you help them before you go ahead and provide care. If a person can speak or cry or make a forceful cough, all you should do is encourage them to continue coughing. Don't provide any care, and make sure you're monitoring this person for any changes in their signs and symptoms. So simply, if someone's coughing, just say, keep coughing, you're all right, you're going to get the object out. Keep coughing, you're going to get the object out. Just to encourage them to force the object out on their own. A lot of times if someone has a partial obstruction and they are forcefully coughing, they will be able to clear their airway on their own. However, it is possible that that object could flip or change direction, now creating a complete obstructed airway. If the person is producing a high-pitched sound or coughing very weakly, or if the person is unable to make any sound at all, we're going to assume they have a complete blockage. And if we don't take care of this blockage quickly, they will become unresponsive. At this point in time, you should go ahead and have someone call 911 or the designated number for the person who is choking. So how do we care for that adult or child who is responsive in choking? Your skill sheet 4-1 will show you your step-by-step instructions. So the care you're going to provide will be 5 back blows, followed by 5 abdominal thrusts. Now, it does not matter which you start with. You can start with your back blows, you can start with your abdominal thrusts. It's really whichever one you think of first and go to. So 5 back blows. The back blows consist of positioning yourself to the side and slightly behind the standing person. You're going to wrap one arm diagonally across the person's chest, and with the other arm, you're going to lean the person slightly forward and administer 5 individual back blows. These back blows are going to happen with the heel of your hand right between the shoulder blades, and they really should be their own individual forceful hits to the back. Once you've administered 5 back blows and nothing's changed, you're going to go ahead and administer 5 abdominal thrusts. Standing directly behind the person with one foot between theirs, you're going to wrap your arms around the person's waist, locating the navel, which is the belly button. You're going to place one hand directly above that navel. This hand should be made into a fist with the thumb pressing into the person's abdomen. Wrap the other hand around that first hand and firmly thrust in and up on the person's abdomen. Each thrust should be their own individual motion. In the case of a child, you may need to kneel yourself so that you are at more equal heights with the child. However, this is the care for a child and an adult, not an infant. This is just a picture to show you back blows and abdominal thrusts. They're not the greatest pictures. You also see here the care for an infant, which we're going to talk about in a minute. In class, I will show you and demonstrate, and we will practice on each other how to administer care for consciously choking. So what we're going to do is we're going to continue these cycles of 5 back blows and 5 abdominal thrusts until either the person begins to cough, speak, or cry on their own. At that point in time, if they are forcefully coughing, encourage them to continue coughing. The object may not have been dislodged yet, but you may have changed the positioning in the object, and now the person may be able to cough it up on their own. The object is visibly dislodged and the person begins to breathe normally. The person goes unresponsive, or more advanced help takes over for you. A few special situations to consider. So you might have a person that is too large for you to wrap your arms around their waist. In this case, instead of administering abdominal thrust, you're actually going to perform chest thrusts by wrapping your arms around their chest and positioning your hands just as you would for abdominal thrusts. So you're just going to do this in the middle of the chest, right on the sternum instead. If you have a person who is pregnant, you're actually going to do that exact same thing. You're going to perform chest thrusts instead of the abdominal thrusts. If you have a person who is in a wheelchair, you're going to care for them just as you would as if they were standing, but you're just going to have to take note that you might have to change your standing position a little bit. Also, in this case, if abdominal thrusts are too difficult or they're not effective, you can administer the chest thrusts instead. Also, just something to take note of, if you are alone and you are actually the person choking, you should call 911 immediately. Yes, you might not be able to speak or make any sound on the phone, but they're going to send someone out anyhow because you have initiated that call to 911. Stay on the line. Attempt to perform abdominal thrust on yourself if you can by placing one fist into your stomach and one hand wrapping over it. If you are unable to perform successful abdominal thrust that way, you can lean your abdomen firmly into something such as the back of a chair or a railing and forcefully press your abdomen into those objects. So how does care change for an infant? This is skill sheet 4-3. As I mentioned before, it will give you your step-by-step instructions. When providing care for a choking infant who is responsive, we're now going to administer 5 back blows, but now we're going to administer 5 chest compressions. So you're taking out the abdominal thrusts and replacing them with 5 chest compressions. Also, to note, the hand positioning that you are going to be using when administering 5 back blows and 5 chest compressions. So if we go back a couple slides, you can see the picture on the left. You are actually going to be cradling the infant in your arm while providing care. This allows you to have the infant's head lower than the chest, allowing gravity to help pull that object out of them. If only we could do that with an adult. Okay, so the 5 back blows, and position the infant so that they are face down along your forearm. Always be sure that you're supporting the head and neck and you're not covering the mouth. Remember that infants, especially when they're very young, they are unable to support their head and neck, so you are going to need to do this. To support the neck, you can use your thumb and other fingers to create a C around the base of the jaw. You should lower the arm so that it's resting on your thigh and the infant is upside down at an angle. Next, you're going to firmly strike the infant between the shoulder blades with the heel of the opposite hand. And just like for the adults, each back blow need to be their own individual movement. If the object has not come up and nothing has changed, you're going to flip the infant into your other arm. So you do so by sandwiching them with your other arm and rotating them over into your arm that was previously free. I will demonstrate this maneuver in class. I know it's a little confusing to think of. Once the infant is secured in that opposite arm, you need to position 2 to 3 fingers on the center of the sternum as you would for CPR. So essentially you're performing your same chest compressions that you would during CPR. However, you're only administering 5 of them. Also note, you can do this from a standing, kneeling, or seated position. You should always choose a position which allows you to support the infant safely against your thigh, as well as has the head lower in the infant's chest. And just as we did for the adult or child, you're going to continue until the infant begins to cough, cry, create any sounds on their own. The object is visibly dislodged and the infant begins to breathe normally. The infant goes unresponsive, or more advanced help arrives and takes over for you. If the person becomes unresponsive, it's important that you make sure that they get to the ground safely. So when we were previously talking about caring for adult or child and I was mentioning your feet positioning, it's really important that you have a good stable base for yourself because you could be holding on to that person and they could go unconscious in your arms. So you need to be able to get them safely to the ground as well as not fall over yourself. You're going to go ahead right into CPR, starting with chest compressions. After compressions and before rescue breaths, you're going to open the person's mouth and look for an object. If you see the object, remove it by using one finger to scoop it out. However, if you don't see the object, do not place your finger in their mouth. You want to make sure that you're never performing what used to be called a blind finger sweep. Why is this important? We have talked about this in the cardiac emergencies chapter. So you may have heard, remember hearing this care in the cardiac emergencies chapter, remember what I mentioned, if you gave a rescue breath, after your 2 rescue breaths, if neither of them went in, you're going to start that modification in which you look for an object between compressions and breaths. That's because you're assuming that the person has an obstructed airway. Now, you could have 2 situations. You could be previously caring for someone who was consciously choking, and so when they go unconscious, you know they were choking. However, you could come upon the scene and find your unresponsive person and begin CPR. And when those 2 breaths don't go in, you now assume that they were previously consciously choking, and that's what made them go unconscious. So just to kind of think about multiple scenarios that you could be in. So you're going to continue this care until help arrives or takes over, or someone else that's certified comes and takes over for you. The person shows signs of responsiveness. If so, care, as we mentioned before in CPR, when a person shows these signs. Or the object is removed. The object is removed and the person is still unresponsive and not breathing. Continue with CPR. You just won't need to do the modification of checking for an object in between compressions and breaths. So now we've added choking to our 3rd C. So you have your check, call, and care, and now you know how to care for cardiac emergencies as well as choking situations. I'd like you to practice and review putting all these steps together. Think of a few scenarios that involve choking situations. So there are multiple different situations. Don't forget about changes in age, so adult, a child, and infant. Write down these steps from start to finish with all 3 of your C's and bring them to class for discussion. In review, I want you to go ahead and take a look at these review questions. Attempt to answer them before using any course materials, but if you can't, go ahead and use your course materials. These will be helpful for the quiz as well as further testing in the class, as well as making sure that you're prepared to go ahead and give all of these skills a try in class. See you soon.